Good day, everybody. This is Chris back again, and what I want to do now is I just want to go ahead and do a quick overview of your clinical forms. This is not an actual clinical orientation that I'm doing, but I do want to take a few minutes to at least orient you to all of the different forms that you're going to be using and filling out during your clinical rotations. So what I'm going to do is I'm going to go ahead and go down and we'll go into Canvas here. And if you look, I have the OEM 150 section D01 opened up. And if you go down to the very bottom, so you have the modules tab here. If you go down to the very bottom of the modules, I've added a new module called Clinical Paperwork. This will be populated with spreadsheet files and Word documents. And I want to briefly go over those documents just so you guys are familiarized, or if you had any questions prior to getting into the clinical environment, you could review this video. We'll talk about these in class as well during your clinical orientation. So there are several different types of paperwork that you guys will have to fill out in the clinical environment. And I'm just going to go ahead and open those up and briefly review them one by one. Okay, so the first thing is something called the clinical PCR, or the clinical patient care report. And actually what I'm going to do is, these are opened up in the web browser. I'll actually open up the Excel for you. So here's a clinical PCR, and this is the document that you will fill out during your hospital clinical rotations. Okay, so the clinical PCR, clinical patient care report, is what you will do on your hospital patients. And we'll talk a little later on. You have so many medical patients and so many trauma patients that you'll have to do an assessment on. I believe 10 of each at a minimum. So if you are, when you are doing your clinical rotations at Memorial Medical Center, this is the form that you will fill out on every patient that you come in contact with. That includes patients you do procedures on. If you do procedures such as an IV or you administer medication, you need to do an entire PCR on that patient. It's very pretty self-explanatory. You put the name in, the date, the chief complaint, their gender, how old they are, how much they weigh in kilograms, how did they get to the hospital, what's going on with them, what was the either mechanism of injury or the event leading up to the illness, what's their history of present illness, get their vital signs. If you give a medication or do an intervention, you need to get a set of vital signs after you do the intervention, and you need to do a reassessment. You'll then do your physical exam, and this falls under the D chart assessment. And then you need, down here, you need to list possible diagnoses for the patient's condition. Sometimes they'll be known, sometimes they won't. And you will need to back these up. Why do you think that this is an applicable diagnosis? So this is the clinical PCR report. And it actually is one of two forms. There's actually something called the PCR second page for your field experience. And this is just, you will basically put every patient that you came into contact here. You'll put the date, where you were at. You will not put the patient's name. You'll just put their age and their gender and their chief complaint, and you'll just keep a running list of all medical and all trauma patients that you run across. If you need additional space, let's say you did a more detailed, in-depth physical assessment, or perhaps it was a code, cardiac arrest, or respiratory arrest, or something extensive like that, you can attach additional pieces of paper with that narrative to that chart. So don't think that you're just limited to this one page. Okay, so that's one of the things you'll be filling out in the hospital. Let's talk about what you're going to do when you are doing your ambulance rotations. You'll either be doing those rotations with American Medical Response, AMR, or more than likely, most of you will be doing rotations organically with a Las Cruces Fire Department. Okay, how about that? Facebook is blowing up on me here. All right, so this is the ambulance PCR, or the ambulance patient care report. Okay, so you'll put your name up at the top here, the run number, who your field preceptor is, if you are running it as a team leader, the date, and the name of the service you were with, AMR or Las Cruces Fire Department. Now, it could be one of any number of approved services, Alamogordo, AMR Alamogordo, Deming Fire Department, Gila Regional Medical Center, EMS as well, are all potential services you could go with. Dispatch information, non-emergent, emergent, arrest, so on and so forth. How old is the patient? Sex, race if you can. What was the disposition? Did you transport them emergently or routinely? Did you treat them and they refused? Did you do an interfacility transfer? Were they dead on scene? Code maybe got called. Was it just a standby, false call, or even canceled? Put that information here, and then you do your primary and secondary impression. And here you basically just circle. Is this abdominal, respiratory, cardiac, etc.? If it's traumatic, what's their primary traumatic problem, secondary traumatic problem, mechanism of injury in here, their medical history in here, any medications they're on, their past medical history. You'll calculate your revised trauma score here, allergies, vital signs in here, their AVPU level of consciousness, their Glasgow coma score. Right here, if you did a satellite G or a glucose on them, any medications you give, any IV, IO access you did, and you can attach additional pieces of paper if you need to add to your narrative, if it was an extensive call. Okay, so this is the PCR that you will fill out for every ambulance run that you do. Okay. Now, what you're going to need to do in addition to these is you'll have a skill checkoff sheet, and I'm going to pull that up here. This is your iSkill checkoff sheet, and these are the minimum number of skills that you're going to need to do. You are going to need to perform 10 IVs, 5 blood draws, 5 med pushes, administer 2 nebulized medications, deliver 5 verbal reports. That can be a radio report, and then 5 verbal transfer of care. This is a report that you do when you arrive at the facility and you transfer care of your patient over to another healthcare provider, obviously at or above your level. The big change that we're seeing in the last couple semesters is right here in the blood draws. Traditionally, we've drawn blood at a Memorial Medical Center. However, the MMC lab is now mandating that their lab do all their blood draws for QA, QI purposes. They were getting a lot of hemolyzed blood samples and having to redraw, and they attributed some of that potentially to students. And so they just said, you know what, we want to, the onus will be completely on us. We'll be doing all the blood draws. So you're probably not going to get any blood draws. However, IVs will count as blood draws, so if you can't get any blood draws, you'll just end up having to do 15 IVs instead of 10. Now, these are minimums, okay? These are minimums to pass. If you want to do exceptionally well and you want to get a very good grade, you're going to need to do a little more than the minimum, naturally. These can occur either in the hospital or on the ambulance, okay? These are not limited to just what you do in the hospital. This is across the board. If you do an IV on the ambulance, you put the date and you initial it, okay? If you give a neb in the hospital, document if you give a nebulizer on the ambulance, and so on and so forth. So don't think that you're just limited to one area or the other on the skill checkoff sheet. Okay, so there's that sheet. We talked about the clinical log. Every clinical shift you work, and it doesn't matter if you're on the ambulance or if you are working in the hospital, every shift you need to fill out the clinical log. You just put the date, the site you were at, the hours that you were at that site. So the site will either be MMC, AMR, Las Cruces Fire, the hours, and then you need to have your clinical preceptor sign here to verify that you were in fact at that clinical site. Okay, and then we will talk about the next form. I know it's a lot of forms, but that's just kind of the way it goes, unfortunately. You know, you need to capture all this data. Just to show that you're doing what you guys need to be doing, and we're doing what we need to do to facilitate that you graduate as minimally competent advanced EMTs. The next thing is something known as a shift evaluation. The shift evaluation is basically what your preceptor is going to fill out for you. You're obviously going to put your name, the site you were at, your level. You're going to circle I for intermediate, and then your preceptor is going to fill out this area here. In addition to you will do your own rating, a student rating. You will rate yourself 1 through 5. 1 is not so good, 5 is really good, and then your preceptor will rate you as well, and then you and your preceptor will write any comments if comments need to be written here. Okay, so basically this is the evaluation for you, give you an idea of how you're doing, and then you will have to evaluate your preceptor. And this is the preceptor evaluation form. Okay, this is what you will do for every preceptor. For example, if you had 2 different preceptors in clinicals and another preceptor on the ambulance, you'd write them here, and then you'd go ahead and fill out the form for those preceptors here. 1 being poor, obviously 5 being excellent, and you're more than welcome to write comments if you want to. All right, and that is the end of all the forms that you're going to need to do. So what I would recommend, or what you're going to need to do, is you're going to need to print out several of these forms. You're going to need, obviously, you're going to need at least 10 of this, and maybe 10 of the hospital, to make sure that you have enough forms to cover all the PCRs. And you're going to need, what I would recommend you do is get a large 3-ring binder and put all of these forms in a nice orderly fashion into that binder. And I would put tabs for every clinical day, every clinical shift. So you can get those little tabs, and let's say you do 3 shifts at the hospital, you have 3 tabs each shift, and then you do 4 shifts on the ambulance, another 4 tabs for that. And then every day, all the paperwork, all the appropriate paperwork needs to be filled out. You're going to put in that binder. And at the end of your clinical rotation, you are going to turn that binder in to me. I'm going to look through that binder, and I'm going to look through all of your charts, and we'll go through it together. We'll make comments, see how you're doing. We'll talk to the preceptors, and ultimately we'll either say yay or nay as far as proceeding. And we will need to keep that binder that you fill out. That binder is a permanent record now, and it gets filed away in a locked room. And then when we get inspected for accreditation, they will ask us to pull out our documentation of the students, and this will be a part of the permanent documentation where we keep it for several years. So it is critically important, and you will not be able to get your course completion. You will not be able to get a passing grade and proceed on to take National Registry if we don't have all of the appropriate clinical paperwork filled out and put into that binder in an orderly fashion. Okay, guys, hopefully you found this helpful, and obviously we'll be talking about these in class as well. And if you have any additional questions, we'll hopefully get those worked out before you guys start clinicals. Okay, guys, we'll see you in class.